Hello and good evening, and thank you for joining us this evening for this program. My name is Ellis Dean, and I work with blackdoctor.org, and you'll see me on other programming that we have. But we wanted to schedule this special session tonight with you all because we want to have some updates with regards to where we are with the vaccines and the variants. And so we know here recently there has been a lot of conversations, a lot of dialogue in the news and on social media in particular about the vaccines. In particular, that the vaccine rates have been going up, as well as the variants, as we know that the Delta variant has become the dominant variant, particularly in the southeastern portion of the United States. And so we wanted to have some conversations to be able to address some of the new things that have popped up, give you an update on where we are with regards to the vaccines and the vaccinations, and to answer any questions that you may have with regards to some of the things that we're seeing out there in the atmosphere, particularly like, if you're vaccinated, do you need a booster shot? If you're vaccinated, can you get infected? So these are some questions that we want you to ask. If you have those questions, if you have some concerns, if you're unvaccinated, we'd like to be able to address those concerns because frankly, I was looking at the data from the CDC right before I came on, the initial variant that we came in contact with in COVID at the beginning of the pandemic, the infection rate was for one person would infect about 2 people if they were infected. The Delta variant is a much more aggressive variant, and it is affecting anywhere from 4 to 6 people per one person that gets infected. And so, as you can see, there is a heightened need to get things done. So again, I see some people that are lining up there in the comment section. Thank you all for joining us. Stars, Karen, Martine, Nancy, Joy. Thank you for joining us. If you are, let us know where you're watching from. We'd like to know where you're watching from because we can address some of the things that are going on in your particular area because every part of the country is different. We know the Southeast has been a hotbed. We know Florida has been going crazy. We know some states and some areas have been really good about getting vaccinated. And so shout out to those states and those areas. But we also like to know, hey, if you're in an area that is not highly vaccinated, what are some things you can do to protect yourself? So shout out to Tamika in Georgia. I am in Georgia, so we know we're all over the place here. So again, thank you all for joining us, and we're going to get started. So one of the first things we're going to do is I'm going to play a short interview that I did with Dr. Lisa Fitzpatrick. She runs Grapevine Health in DC, and she is an infectious disease specialist. She has been on top of this whole vaccine virus thing since the beginning because that's what she does. She was also part of the original clinical trial. So she has been vaccinated. She was one of the very first people to get vaccinated. And there's a video that she had posted on YouTube. That was her reveal because, when you do a clinical trial, what they do is they put some people in a control group and they give them a placebo, and then they put some people in the actual vaccine group that gets the vaccine. When she did her reveal, she was in the vaccine group. So she's had the vaccine for quite a bit now. So we're really excited. So she couldn't come on live tonight, but she did. She was willing to do a short interview. So I'm going to play that short interview, and we're going to address some of those questions. And so if you have more questions, I see you, Sheila. You want to know more about the vaccine, we can definitely address that tonight. So again, sit tight. I'm going to play this interview, and then we're going to come back, and then we're going to address your questions that you have. This is all about vaccines and variants, and we're going to have a COVID-19 update for you this evening on Black Doctor. So I'm here with Dr. Lisa Fitzpatrick, and we're going to ask her just a few questions about what is happening because we keep hearing this dirty word known as variant floating around the country, and we need to get a kind of a better understanding of what is a variant and why do we keep getting new variants popping up all over the place.
Yeah. Thanks for having me today, Ellis. I know it's frustrating. I'm frustrated. Every time we think we're seeing the light at the end of the tunnel, we get a curveball thrown at us by this SARS-CoV-2 or this coronavirus.
Right.
Though variants are simply mutations on the virus. So what is a mutation? Think of a mutation like an imperfect copy, something that happens when you make a copy, because viruses, their whole purpose is to find a host, copy themselves, and then wreak havoc, which is what this COVID virus is doing, right? Yeah. So when it copies itself over and over and over again, it makes mistakes. So think of it like copying a document. If you make a document, if you photocopy a document and you hold the original up next to the photocopy, you will see what you will be able to tell which one is the original and which is the copy, because it's not perfect. So it makes some mistakes. So when viruses copy themselves, they make mistakes, and these are mutations. And that's all a variant represents, is there are some mutations that have happened when the virus copies itself. Now, what you need to be concerned with a variant or these mutations is whether or not it changes the way the virus behaves once it gets in your body. And so that's why we've been obsessed with whether or not it's more infectious, or is it more easily transmitted. So we're hearing this Delta variant, for example, is much more easily transmissible, meaning if I have coronavirus with the Delta variant, I might infect 5, 6, or 7 people. But remember, the initial coronavirus, we said it was probably 1 to 3 people. It was a much lower number, and so that's the concern. The other factor we look at is whether or not it makes people sicker, and if it's more deadly. So when these viruses create these mutations as they copy themselves, most of the time it's just something that's inconsequential. But because of what we're seeing with this Delta variant, it's everywhere. It's 40 to 50% at least of the new cases across the country. It's spreading very quickly, but we're not sure yet if it's really more deadly. It may not be, but the fact that people are still getting infected with coronavirus is concerning, because we still have so many people who are unvaccinated.
So you make a good point. If we're going to continue to have these variants, why should somebody get vaccinated if these variants keep popping up and we don't know how infectious they are, we don't know how deadly they are, what they're going to do? Why should somebody even go get vaccinated now with the Delta variant and potentially other variants out there?
Well, I think another issue to raise around mutations are happening because there are people who are still susceptible to infection with coronavirus. So if you find someone who's not protected, meaning they haven't had COVID-19 or they haven't been vaccinated, then that's an opportunity for that virus to get into the person and start replicating. And so the more we have people walking around with no protection against the coronavirus, that's why we will continue to see more mutations. And so this is why we want to encourage people to get vaccinated, because sure, there are a lot of people who've had COVID-19. If they've had it recently, maybe they've had it with Delta and they probably have some protection. That's the way the immune system works. But the problem is there are too many unknowns about how good that protection is, how long it lasts. And we know the vaccinations, even if you've had COVID, are like a top up. They add extra protection. So even if you get COVID, you should have a mild case of COVID-19. And people also ask me, Ellis, well, why would I bother getting vaccinated if I could still get COVID?
Yeah, that's the next question.
And I just want them to think about 2020, when the hospitals were full of people, and we had so many deaths, and there continue to be deaths around the world from people who are unprotected. And so if you have a choice of being protected and still getting COVID, but it's very mild or you have almost no symptoms, versus potentially being hospitalized or even dying, like that's a risk I would take.
Yeah, I think, and so the term that you're going to see in the news is called breakthrough cases. So if you see that, that is the terminology that's being used for somebody that has been vaccinated, has been fully vaccinated, and still caught COVID. So breakthrough cases, what Dr. Fitzpatrick is telling you, you can still get a breakthrough case of COVID. The vaccines aren't designed to prevent you from getting COVID. They're designed to prevent severe illness and death. And to this point, the vaccines are doing a good job in preventing severe illness and death. And that's really the most important thing, not whether or not you catch COVID. It's about how you survive and how you go through the course of if you do get it. So
I just want to be honest and, tell people we can't know everything about this virus or these vaccines or what they're going. People say, well, I want to wait. Let me wait and see what's going to happen. We can't know everything, but we know enough about the safety of these vaccines. We know that the rates of hospitalizations plummeted once we started getting people vaccinations. The number of deaths plummeted. And now the people who are dying, they're largely people who are unvaccinated. Right. So people who are still saying, I want to wait, or I don't think the vaccines are safe, I think that personal risk assessment is, am I someone who is going to be in trouble if I get COVID-19? Right. We can't ever know everything about every possible situation, right, because people will always ask me when they're pushing back about getting vaccinated or about even wearing a mask. They'll push back and come up with these very rare and unlikely scenarios and say, well, what about this? Well, what about that?
Right.
We really have to think about the abundance of information we have right now about what COVID does to you, especially if you have heart disease, diabetes, if you are someone who generally has chronic health conditions.
Right.
It's a big risk to take. But then also we have a lot of children who are unvaccinated. And if they come in contact with adults who are not vaccinated and carrying this virus around, they can infect our children.
And those cases are going up. I read an article just recently that talked about the cases of children.
But why is that? It's because the virus is looking for bodies that are unprotected.
Right.
It's looking for the easy, sort of the easy target.
So think about like in medieval times, and you had a castle, and that castle had a moat and a drawbridge and guards out front. That's your body with vaccine. Yeah. Or you just a city with one person out there with a slingshot. So that's unvaccinated. So I'm going to give it to you in a different way, but ways that people want to, we need to think about it in terms of that vaccine provides an extra layer of protection so you can survive. And so ultimately that's what vaccines are designed to do. So,
and with all that protection, one little enemy might be able to get through, but once they won't penetrate too far into the castle because there are other lines of defense. So if they, breach the first barrier, maybe that's your symptoms, but it gets stopped after that, right? So just to carry on with your
with my medieval analogy there. So, all right. So there's a question that we've been seeing a lot, and I've seen some articles about it because I'm staying on top of this. Moderna has come out and said you probably gonna have to get a booster shot. Pfizer has hinted at, the Pfizer CDO has hinted at that. I noticed that the CDC and the FDA and WHO have said, wait, let's hold off on the booster shots because they want to get the unvaccinated people vaccinated. And if we start having people that are vaccinated run out and start getting booster shots, then we're going to hit the vaccine supply that we have because they're going to run out and get booster shots and the unvaccinated people are still going to remain unvaccinated. So what's your stance on booster shots? Should people go get them? Or is that the wait and see?
I honestly think this conversation about boosters for the United States is pretty premature because we have a whole globe. There are some countries, 1, 2, less than 10% of people vaccinated.
Yeah.
And this is not just about Americans getting vaccinated. As much as, we're a society, we usually think about ourselves,
Right.
what's happening here in the United States. But because of international travel, we are so connected to the globe, whether we like it or not, or whether we recognize it or not.
Right.
So how would that be for Americans to start getting a third shot when most of the world hasn't even been vaccinated or received access to vaccinations?
Right.
The only group I might make an exception for are some of our seniors and people with specific chronic health conditions. But even that, I would have to think twice, because these vaccinations produce a very strong immune response, and it lasts longer than we thought. This is, again, in that area of not knowing what we don't know. In the beginning, we said, 3 months, you're okay. And this is what's frustrating, because the information keeps changing. And so the longer we have experience with this virus and these vaccines, the more we learn. And so just in case people are wondering, well, how do you know how long it lasts? There are ways to test to see if you still are responding to the vaccine. But there's also more than just the antibodies we talk about. So when you get the vaccine, your body produces antibodies as a defense mechanism. But there are other components to your immune system that also will wake up and respond to a threat to your immune system. And so that's not as easy to measure. So I'm not a fan of running out and telling everybody to go get a booster. I'm one of the first people to get vaccinated in the country. I got my vaccine in September. And I'm not running out to get a booster. We have to figure out how to vaccinate the globe. Maybe prioritize some folks in this country, but once that floodgates open and some people in the US start getting them, people will find a way to game the system and get these booster shots. So, but it's all a big unknown, because I think we still have a lot of protection against these viruses, even the variants. I think because the variants are cousins to that original strain, yes, it may produce a different set of symptoms or look different. The body still can recognize some components of this SARS-CoV-2. So again, we still have a lot to learn, but I don't think it means run out and get a booster shot. Not yet.
Well, you bring up a wonderful point, and we actually, I wrote an article that we posted on blackdoctor.org about the worldwide COVID problem for nations that have high Black populations. And so talking about Africa has anywhere from 1.2 to 1.3 billion people, but most of the countries there are less than 2% fully vaccinated. And so when we're talking about that, their goal in many African nations was to have just 10 to 20% vaccinated by the end of the year. And it's looking like, because what happened in India and with the rise of the Delta variant, that they're not going to hit that goal. It's going to be about 7%. So when we're thinking about a worldwide phenomenon, we've got a lot of people from Africa, from Nigeria and Kenya and Ethiopia, and that travel to and fro the United States. It is a worldwide epidemic, and you're absolutely right. We need to get to some semblance of worldwide fully vaccinated before we can start even thinking about booster shot. But you can go get your antibodies tested, right? You can go get your antibody level.
It's not perfect, though, and it's not easily available to everybody.
Right.
But I think people should be reassured that these vaccines, have been shown to cover the Delta variant. Again, it's not 100%, but because your body has recognized, like if you have either had COVID or you've gotten the vaccine, some part of your immune system will recognize that. It may not be the best protection ever, but you still will have some protection. And what we've always wanted is to prevent hospitalizations and deaths. And that's what's happening. Like, this is definitely still an epidemic or a pandemic of unvaccinated people.
Right. So last questions and get you out of here. What do you know about this Lambda variant? I've seen this pop up. It's out, so we're going down the Greek alphabet. So we're Delta right now is dominant. Have you heard anything about the Lambda variant, and should people be concerned about that, or should they just be focused on going to get vaccinated to protect themselves at any level?
Well, I know the Lambda variant is definitely emerging. It's in South America. Have talked to some experts over there about that. But at the end of the day, these variants, the reason we're seeing them is because coronavirus is continuing to copy itself and finding hosts that have no protection. And so until we get on top of that, until we can reduce the spread of coronavirus, we will continue to see variants and keep going down the alphabet. Our worst nightmare is to encounter a variant, to have this virus keep mutating and making a significant enough mistakes that it does become more deadly. So I've always seen this as a race against the clock for us to get enough people protected from COVID-19 or from SARS-CoV-2, no matter the variant, enough people so that the levels of transmission drop so drastically that we can actually see the end of the pandemic. So even if people are not vaccinated, they still have the power to stop transmission. And the first thing we have to do is recognize when we have symptoms. Although symptoms, can be very mild and some people will have no symptoms, having no symptoms is much less likely than people having symptoms. So if you have symptoms, and it doesn't have to be loss of smell and taste, cough, fever, shortness of breath. Some people just feel tired. Some people might have back pain, a sore throat. So anything, really do your own assessment of your body. And if something is not right, give it a few days and to see if this will declare itself, get tested, because that is the only way we're going to interrupt transmission for sure, is if people who are infected with coronavirus are not transmitting to people who have not been vaccinated or who have no protection whatsoever. So we have the power. So as much as we push back against masks, they actually have helped. Yeah. And the social distancing, I know we're tired of it. But if you are someone who has symptoms, get tested for coronavirus. I know it's a drag to have to quarantine for 10 days, but this is how we get out of this pandemic. We have to go back to the basics, Ellis.
Yeah. You're absolutely right on that. And I thank you for the time. I know you're very busy, especially with all this new stuff popping up and going on. So I know you're very busy. So I appreciate you giving us the time here, Dr. Fitzpatrick. We look forward to having you on again. But hopefully with more positive news, that the numbers are going back down. So I love to have that conversation versus trying to give people an update on how to stay safe. And keep our kids safe.
I would just say, I think they will, because if this Delta trajectory in the US follows patterns in the UK and other places, there was a steep rise and then
Okay, I don't know what happened to the audio at the end there, but that was wrapping up. And what Dr. Fitzpatrick was saying was that the patterns that have happened with the Delta variant in other countries around the world that got it before we did, there was a steep rise and then there was a sharp decline after the steep rise. And so that gave, she said that as a way of encouragement to let people know, to let all of us know that we are not in a place of panic, but we do have to be diligent and we have to be intentional about how we approach the Delta variant and how we approach this pandemic going forward. And so we're going to bring in now Dr. Michael Lenore. He is with us live here this evening. And we're going to answer some of your questions. I've been trying to answer them as we were playing the video with Dr. Fitzpatrick. But again, I'm going to ask some of those questions that you were asking in in the comment section. So continue to ask your questions. First thing, we're gonna do some rapid fire here, Dr. Lenore. Make sure you take yourself off mute. But what we're gonna ask is some of the things that people are asking are side effects. What are the side effects that are vaccinated? And I know they're individual, but let's kind of talk about what have been reported in terms of the general side effects from people when they get vaccinated.
Yeah, first of all, the side effects are relatively rare, but most of them are discomfort at the site of the injection. And also some people get a low-grade viral-like problem. It usually lasts a couple of days and then disappears. There's some confusion about people who have allergies. People with allergies don't have much trouble with the vaccine no more than other people. It's people who have problems with a flu shot or other vaccines that share the same components as the coronavirus vaccine, mostly the polysorbate. Allergists, as allergists, we can test for that. But I think there are very few side effects relative to the number of vaccinations being given.
Absolutely. And just if you could kind of help our audience understand how vaccines work. I know there have been a few comments about we don't know the long-term effects, and it's been my understanding that when the vaccine is just to kickstart our immune system, our immune response, to teach our immune system to recognize that crown piece of the coronavirus. And then once our immune system kicks in, our body flushes out the other components of the vaccine, so the vaccine does not stay in our system for an extended period of time for us to have long-term side effects. Is that true?
Well, the characteristics of a virus are very different. I mean, there are some pieces that help the virus get into the cell. Some people help it get into the nucleus, some parts that help it multiply. Well, one of the most important part of that stage is that the virus has to break into the cell. And so they do that with what they call a spike protein. So when we make a vaccine, you don't have to make a vaccine to the whole virus. You could just make a vaccine to that spike protein, and then the virus can't get in cells. And that's what the vaccines have been done. There are other vaccines on the horizon that do it differently, but the current vaccines, that's kind of the way they work. You do not have to have an antibody to the whole virus. If somebody can't get in your house, there's nothing they can do to you on the inside. And that's basically how that all works.
Okay, and so I'm going to address this. I'm add a little bit to that, and so people can kind of get some context, right? So I'm going to give our audience some context when we're talking about focusing on the long-term effects of the vaccine. The biggest concern should be the long-term effects of catching COVID, not about the long-term effects of the vaccine. And why am I saying that? Because I know that sounds harsh, but the reality is this. President Biden has signed into effect, he has added people that have gone through COVID and survived COVID. He has added them to the Americans with Disabilities Act. That means that later on in life, if you've had COVID and you survived, later on in life, if you start developing symptoms, complications as a result of your having had COVID at one point in your lifetime, then you will get disability benefits and coverage by the Americans with Disabilities Act. As of this point in time, there has been no long-term implications from anybody having been vaccinated to have any kind of long-term effects associated with it. But we're already showing what's called long haulers. You can look that up on Google. If you want to do your own research, you can look that up. Called long haulers. There have been studies in England, there have been studies here in the States about people reporting symptoms well after they become clear of the volume of COVID, that they're still having symptoms that's affecting them going forward. And so that should be more of the concern. Now, if you don't want to take the vaccine, that's fine, but still protect yourself from catching COVID, because it has shown and more studies are showing that it has a long-term effect on the body, not just that period of time where you're ill. So next question is the Dr. Fitzpatrick talked about how variants are created. I know you mentioned you talked about Delta plus Lambda. Where are we in terms of? And I tried to mention a little on my opening remarks, talking about how more contagious, how it's more easily passed the Delta variant, and that's why it's become the dominant variant very, very quickly. what can you tell us? What other information can you give us about the Delta variant or potentially the Lambda variant that we're seeing in South America?
Only that they forecast things to come. There are lots of variants that appear in all kinds of places all over the world, but they don't have certain properties. But occasionally a variant comes along that has the unique property of being 1,000 times more infectious than the original variant. It's not perfect. For instance, if it was in a group of other viruses, it would be considered disabled, maybe ugly, maybe ineffective. But because it has certain properties, in addition to the mistakes it makes, getting into cells and multiplying more quickly, all these variants tell us right now is that most of the time the vaccine prevents serious disease. But there's going to be a variant that comes along that's going to look at the vaccine and kind of laugh and move right into that cell. And that's what everybody's trying to prevent, trying to avoid. For instance, in Australia, where they closed down just about everything every time there was a surge, there's no meaningful number of viruses in that community. So consequently, people go about life in Australia pretty much as normal because they've eliminated an opportunity for the virus to grow. And that's where we have to get to in this country.
So absolutely. So I want to point people to a Facebook Live we did a couple of weeks ago. We had Dr. Joseph Gath. He's an infectious disease specialist out of Houston, Texas. And we did a Facebook Live with him a few weeks ago. And during that live, he talked about how the coronavirus got to where we got to SARS-CoV-2, which is where we are right now. He gave the history of not only the virus, he gave a history of the vaccines. So he can kind of brought a timeline forward and talked about how mutations got to the point where they mutated enough to get into human population. So I would encourage you to go back. It's a NBNA, and we did it with the National Black Medicines Association, and the title of that particular Facebook Live is Obesity and COVID-19. And he really kind of broke down the history of the COVID-19 as well as the vaccine. So I would encourage all our viewers, and if I get the opportunity, I'll put the link into the comments so you can watch it yourself and really kind of get a really good understanding about what's going on. So there's a question. Is it true that the variant has mutated spike proteins resistant to the vaccine?
No, that's not true. The variants are not, they're more infectious in some ways, but they're not resistant to the vaccine at all. They're just not as efficient against the spike protein as they are with a Delta Plus or in certain instances the Lambda, but they're still effective. Most of the people who get COVID who have been vaccinated may have a disease, but it's not the quality of the disease that you get if you have COVID and you're unvaccinated. 99.5% of the deaths are in unvaccinated people. So but when they told you they had a vaccine is not supposed to cover everybody. They always talk about a 5%. It's either 95% or 85% effective. So there's some people who are not going to make antibodies in an effective manner to the vaccines. But most of the time, the vaccines right now are sufficient to keep most people from getting into the hospital or the ICU. They may not be as effective as they are against the Delta virus, but they're pretty good substitutes.
Absolutely, absolutely. And so I'm going to put a couple of stats on the board, and I know a lot of times people are asking about the safety of the vaccine. So here's where we are. Over 167 million people here in the United States are fully vaccinated. Okay, so you might have one or two examples of somebody. I know somebody was talking about a friend of theirs passed out when they got vaccinated. I know I had a friend of mine that said he had some issues with his ears. But we're talking about 167 million, and the majority of those people have not had any long-term reaction with the vaccine. So 167 million people. With regards to, that's just fully vaccinated. And we're talking about 196 million people have had at least one dose. And that is people, their ages of 12 and up. So that's total number of people that are eligible to be vaccinated. over 196 million people have had one dose. So that is a significant number of people. That's why I put it all the way out there. So you can see the entire number in terms of the number of people that have been vaccinated without incident, even children as young as age 12. I will say this, everyone in my household has been vaccinated, including my 14-year-old son, and he has not had any reaction. He had a sore arm for a day or two, and then he went on about his business. Same thing with me. When I got vaccinated, I had a sore arm for a day or two, both times, and then I moved on about my business. But I didn't have any side effects or any symptoms with regards to being vaccinated. So when we're talking about safety, you have to include these numbers when you're thinking about the safety of the vaccines.
Yeah, I had so little response. I went and got some antibodies to be sure that the vaccine had worked, but I had absolutely no problems at the site and no problems subsequent to that.
Absolutely. So yes, so Valerie's asking a question that we already addressed breakthrough cases. So there's a lot of terminology that's going out there, and breakthrough cases is a new terminology. And that what that refers to, for people that don't know, are people that are fully vaccinated that catch COVID. And so that's called a breakthrough case. That means, okay, the vaccine is designed to protect you. The Delta variant has been able to kind of break through. That's why they call them breakthrough cases, and people have caught COVID. Now, as a result of that, but those people have had mild symptoms. Most of those people have not been hospitalized, and there have been very few breakthrough deaths. I have been on multiple panels with medical professionals from around the country, and there have been, as of now, there's been just over 1,100 people that have died that were fully vaccinated from COVID. Now, of that 1,100, a majority of those people had some sort of immune system compromise, where their immune system did not produce enough antibodies when they got vaccinated to combat COVID. And so if you're immune compromised, you need to have that conversation with your doctor. If you go get vaccinated, have that conversation with your doctor. And there are tests that you can do, as Dr. alluded to. There are tests that you can have done that can test your antibody levels. And so you can go to LabCorp and tell them you want to get an antibody test done, and they will pull your blood and they will test antibodies, and you'll get the answer. Also, if you've had COVID before and you haven't been vaccinated, you can also go get an antibodies test, and that they will tell you whether or not you've had COVID before, if you believe you've had it and you have had some mild symptoms. And so you can do that for either way. So again, the breakthrough cases, they do happen. Again, as we said, there's nothing 100%. The only thing that's 100% is death and taxes, right? So we know the old cliche. So that's the only thing that's 100%. So, but we're talking about right now, when we're looking at the numbers with regards to cases, the majority of people that are having severe illnesses and dying, over 99.5%, are unvaccinated people. And right now, the vaccine are holding up against all the current variants that are in the United States right now. And so they're showing to be effective. So that lowers the reasons to get a booster shot. Right. So yeah. So again, I have the Dr. Gath, when we did his interview, I did write down the number of the test that you can go get. But if you can go to any LabCorp, you can go to your doctor and just ask them, hey, I'd like to get an antibodies test run, and they know exactly what you're talking about, and they can give you an antibodies test. If you're vaccinated, it'll tell you what your antibodies level is, to see if it's been coming down. And if you're not vaccinated, they can pretty much tell you if you've had COVID or not, because you'll have antibodies that have been created to fight COVID. So I've had friends that have had the antibodies test done because they got sick right around the time that COVID was around, and they thought, maybe it was COVID, so they had the antibodies test done, and they found that it wasn't COVID. So you can have those things tested. So it seems like the biggest questions right now, Dr. Lenora. So again, please send me your questions. Please get your questions. So
one thing I want to say when I have the opportunity is, we in the first part of the pandemic, of course, the African American community was identified as at risk, and that's still the case. But I personally, as a physician, want to thank blackdoctor.org for their consistent commitment to giving the latest information. I know that we were hot for a while, we were being called on the air for a minute, but I knew that was going to fade. So most of the discussion is not about impact of the virus on the African American community anymore. That once they found out that the Delta Plus was on them, I think we took another backseat. But I think if you want to find out the latest information about the coronavirus, if you've got a relative, then they have the philosophy at blackdoctor.org, as I understand it, that you have the right to make your own decisions, and that's a right that can't be taken away from you. So their philosophy is to give you more information. But I can guarantee you're not, while you wait for the discussion to move forward, you have to pat yourself on the back a little bit at blackdoctor.org for consistently giving to our community the latest information and the real information without being judgmental or without being harsh or accusatory. So I just want to take that little pause in the action to make that statement to people. If you've got a relative or a friend who's not being vaccinated and you want your questions answered, you cannot go through the day. And Mr. Dean, I have to suggest you probably got the most knowledge about the coronavirus than anybody else in this country. It's not
you know what? I was having that conversation the other day as an aside with my wife, and because one of the things is I talk to both sides. And so I talk to doctors and infectious disease specialists on a daily basis. And then I also talk to people, and I get feedback from people and their general concerns. And I also have to research. So I have to go out there on the net and find out the latest on what's going on. And so that has kind of added to a really, big body of knowledge. So with regards to Black Doctor, yes, we have a COVID-19 resource center. If you go to blackdoctor.org and click on, it just says COVID-19 on this menu, click on that, you'll see videos, articles, everything. It's a full repository of all the latest and greatest news about COVID. So there's a question from Sharon. Sharon, what's the effectiveness of just the first shot, and what is the longest time you can wait between the first and second shot and still be protected? I wanted to wait a bit longer than 3 weeks before getting the second shot. So this is what I've learned, and Dr. Lenore, you can tell me if I'm wrong. The 6 weeks is about the maximum you can wait. From what I've heard is about 6 weeks between the shots. It's not recommended that you wait that long. There is some protection that is, that comes from the first shot, but the reason why they have 2 shots is the better protection is getting both shots. And then the 2 weeks after that second shot is when you're considered to be fully vaccinated. But you do get some measure, and this is coming from Dr. Fauci, he said this, you do get some measure of protection from the first shot, but 6 weeks is about the max, 4 to 6 weeks is about the max you can wait between the 2 shots. So I didn't get any pushback, so that sounds like good. All right, so out of the vaccines that are available now, what is the most effective against the Delta variant? The one that you get, right? Because all 3 of the vaccines are proven to be effective in terms of preventing severe illness and death, and that is the number one goal of the vaccines. So neither of the vaccines, not any of the 3 that we have available here in the States, have been shown that all 3 have had breakthrough cases. So there's not one that's going to breakthrough cases, but all 3 have been shown to be effective against severe illness and death. I will give an update because we are still under the emergency use authorization for all 3 vaccines. However, Pfizer has applied for full authorization, and there are some, if you do some searches on the net and some of the articles that I've read from the CDC and whatnot, there are some belief that they could be fully authorized as early as September of this year in terms of their vaccine. So take that information how you want to take it, but that's where we are.
But there are some studies starting to emerge about the differences between the types of vaccines and their effectiveness against the Delta Plus. It does seem, at least in the preliminary studies, that the Moderna vaccine may be a bit more effective, but not enough to cause some consternation. The other thing is that many times people who've gotten the J&J vaccine are getting an additional dose of one of the other vaccines, and that seems to be a cumulative effect which works. The final piece and the most disturbing part of the new information is that what's happening with pregnant mothers. We used to feel that there was no coronavirus impact, but now we know that coronavirus mothers, mothers who get coronavirus prenatally seem to have much more prematurity. And so we're starting to see, and babies are born with the coronavirus positive. I had recently a 6-week-old who was positive with the coronavirus. Fortunately, babies and young children are much more resilient in some ways, and there is an estimate that eventually coronavirus infections will be, vaccinations will probably just take place in kids less than 2.
Yeah, and that's the unfortunate measure. I know that in Texas and also in Arkansas, the children's hospitals are in Louisiana. They're reporting the children's hospitals are full. I talked to a chief medical officer at Jackson Memorial Hospital in Miami. The deaths associated with COVID, in terms of the youngest person dying from COVID, is getting lower and lower. He said earlier this year, the youngest person he had was 28. He said recently he just had a 15-year-old die from COVID, and there has been as young as reported as 23 months dying from COVID in Texas and other areas. And so children cannot be protected because right now, under the age of 12, they can't be vaccinated. So the way children are protected is by, and we had this conversation last night on Wellness Watch with Dr. Lenore, the way you protect children that are under the age of 12 is you vaccinate everybody around them that are in their circle should be vaccinated. So everybody in their home, if you have a child that's under the age of 12, you should be getting vaccinated. When they're out in public, you should make sure you have some hand sanitizers because kids like to touch things, especially young kids. We know I've got 2 children of my own. They like to touch things. Have some hand sanitizer, make sure their hands are clean, and make sure that they have a mask. We also had a guest on last night that makes PPE masks for children. And these are the N95 masks that are proven to be the most of the surgical mask, and she makes them in multiple colors, and everything is for kids, and they're sized for kids, and they're very, very comfortable because they fit their faces, so they don't have to pull them down. So there are a lot of just,
Yeah, and I think that you made the point, and we make the point in pediatrics. It's the N95 masks that are the most effective. Cotton masks, maybe 30, 40%. Surgical masks, maybe 40, 50%. N95, close to 90%. So if you send your children to school, then you want to get an N95 mask. And any child greater than the age of 2 should have a mask of some sort. So I think that was an important piece. And hopefully, because of the creative way in which she's put these masks together, there'll be some way for people to be able to identify where to get these kinds of masks. But it is important, I think, demonstrating clearly that the M95 is kind of place. I'm looking for the M97, but the M95 is a number to remember. Parents have beautiful masks with flowers on them. My wife got a mask to match every color of an outfit that she wears, but ain't like an M95 of one color. So I do think parents need to know that when they send their children to school.
Yeah, I'm trying to remember. It was on our program last night. So if you go to our YouTube page, or if you go to our Facebook page and just look for the Wellness Watch program from last night with myself and Dr. Lenore, the doctor that was on it that has the mask for children, her name is Dr. Samira Brown, and I forget her website. It's something like PPE. We'll try to get that information for you before we shut off, before we end this broadcast. But
one other thing, I want to give parents a little comfort. When they say that the ICU beds have filled up in these hospitals, you have to remember most hospitals have about 1/5 the number of ICU beds for children that they have for adults, and so it's not the same ratio, but still it's a very disturbing statistic.
Absolutely. And so, you've got trauma centers, they have to reserve, and just to kind of give you behind the curtains of hospitals, they have to reserve keep a certain number of beds empty. So when they're saying they're filling up the beds that they have available, but they do still have beds available because a lot of these hospitals are trauma hospitals. And so if a child gets in a car accident or something like that, they have to have beds available for other scenarios. And so when they say they're filling up the beds that they have available, but all of the beds. So like I've even read that some hospitals are looking to build makeshift beds outside in an auxiliary area to be able to, handle the COVID cases that are coming in, so they can keep those beds available for other incidents.
But I think if in fact you don't have you have a reason to not get the vaccination because of who you are, you have to think about our children. And I think that as this goes further and further along, that's going to be an issue. And your sacrifice for the things that make you uncomfortable to protect our children is something that we can all respect and appreciate.
Absolutely. And Black people, we understand. And so I know there was a question earlier about comorbid, I can't say that, situations and instances. Yes, we are still addressing that. I just did a show on Tuesday about cholesterol, and I got a show coming up on this Tuesday about hypertension. I'm going to be doing a show with Dr. Lenore about asthma and COPD. We are still going to address, because we're talking about total wellness for Black Americans. We're still going to address those illnesses that affect us the most. But COVID also affects us the most. And so we're also going to have to talk about COVID, and it is killing us. So yes, you're absolutely right. Unvaccinated people and vaccinated people have died from COVID, but the ratio between the two is not even close. 1,100 vaccinated, 1,100 to 1,500 vaccinated people have died as a result of COVID. Over 617,000 people that were unvaccinated have died from COVID. So it's not even close in terms of vaccinated versus unvaccinated, who's being hospitalized and who's not being hospitalized with regards to COVID. So yes, so it's like saying 1 to 1,000. It's not even.
And here in San Francisco, where of course all people are created equal, as we would have you believe, for every 1,000 whites that get COVID vaccine, 2 people die. For every 1,000 Blacks that get COVID, 12 people die. So you really have to look at, and if you're going to find, quote, fairness, San Francisco might be the place to look. But I'm telling you, something goes on in the society that puts us at greater risk for any chronic problem. COVID is no different.
It is. And so, just to, more than probably what you need to know is that research is showing that COVID is a vascular illness. I know we always talk about people getting ventilated and their airways being extremely having a hard time breathing, but it's vascular. That means it gets into your blood cells. And so it affects other areas of your body, just like diabetes is vascular, hypertension is vascular, cholesterol is vascular. So when you combine those other inflammation causing illnesses with COVID and the inflammation, that's why we're having such the high effect on Black and brown populations as you're not seeing in mainstream, because of, we have higher incidences of diabetes and hypertension and high cholesterol and all those things. And so when you put those things together, that's why you're getting Black people dying at twice the rate.
And when you get a vasculitis, there is no second chance. What a vasculitis means is that the COVID has gotten into these vessels and your body has made its natural response to that. And many times it results in scarring and compromise of the vessel opening. And so consequently, even though you may be getting blood through, you're not going to get as much through because of the swelling and the damage associated with any kind of itis, vasculitis, arthritis, meningitis, any of those itises. When you're in the hospital, somebody say you got an itis, you need to sit up and pay attention, because that's what's really causing the long haul diseases and the other problems associated with people, even those that recover from COVID.
Yeah. So as we're wrapping up here, because we don't want to take too long, there was a question: does that 617,000 deaths of unvaccinated people include people who died before the vaccine was available? Yes, it does. So that's the total number of people that have died from COVID. So those numbers have gone down in terms of the rates of death, but it's not because that the unvaccinated people are fighting off COVID. It's because people started getting vaccinated, so there were fewer people that were dying in a general sense. But when you pull out the people that were vaccinated and you look at the people that were unvaccinated, the death rates are the same with regards to people as they were before the vaccines were available and then where they were after the vaccines are available. So when we're talking about doing our own research and looking at these graphs, we have to look at it as apples to apples, not apples to oranges, because you could just look at a graph and say, oh, the deaths are going down, I don't need to get vaccinated. No, the reason why the deaths are going down is because people are getting vaccinated. But when you remove them from the count, the death rates are the identical, pre-vaccine and post-vaccine. So it has not gone down. It is the same. So you've got to get vaccinated if you want to continue to have the death rates going on. If you want to protect yourself and your family, it is your best choice to get vaccinated. So I will say this, because there was a question as we're wrapping up. There was a question about how do you protect yourself if you're unvaccinated? It's the same as it was at the beginning before the vaccines were available. Wear your mask, wash your hands, watch your distance. 3 W's. It's just that simple. I know we don't want to wear a mask, but you got to wear your mask. You got to wash your hands because that it gets through the membranes. You got to watch your distance from people, especially people that aren't wearing masks. You definitely have to watch your distance from them. Yes. So, Frido, you're absolutely right. So, again, I want to thank Dr. Lenore. I know he's at his office. He's still practicing because he's on the West Coast. He's like, I want to thank you for taking the time out because he felt this was very important.
Anytime we can give them even the smallest bit of information to people and give them the information they need to go through their philosophy of decision making, we and almost all African American physicians I know are more than willing to do that.
Regina, when they do COVID testing at the drugstores, whatever, they send it all to and they get it tested. So you can get now walk-ins. You don't even have to set appointments now to get vaccinated. When I got my son vaccinated, we just walked into CVS, had no appointment, and we were out in after we waited the 15 minutes of him getting a shot, we were done. We were in and out in 20 minutes. So it is very, very easy here in the States. I will say that. I'll add that caveat. It is very, very easy here in the States to get vaccinated. And so please, 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 if you need to get information, because I know people say that they want to gather more information, come to blackdoctor.org, go to our website and go to the COVID Resource Center, and they'll give you culturally relevant factual information. Okay. And that's what I can stress. I go to the CDC to get the numbers, and I go to blackdoctor.org to get culturally relevant information, because we're really here. We're trying to, it's a public health issue, but we're really trying to save, our ultimate goal is trying to save Black people's lives. And we're being hit the hardest by this virus. And so we have to work just as hard, twice as hard, to make sure Black people are here today, tomorrow, and in the future. Yes. So I thank you for that, Hope. So again, thank you.
Yeah, we're gonna be here. Everybody else may be gone, but we will be here.
Yeah, we're gonna be here. So again, thank you all. We're gonna do this again. So don't. This is not a one and done. We're gonna be doing regular COVID-19 updates. So if you've got some more questions, please come back. Please share this. I thank you everybody for tagging friends and family to get this information. Share this video. It's going to be on our YouTube channel by tomorrow. I know it's easier to share a YouTube link. We're going to run it again in the morning. So if people want to see this again, we're going to run it again in the morning. Please, please, please share this information. Please, please, please. If you choose not to get vaccinated, that's your choice. But please protect yourself and your family in every other way possible so you can not catch COVID. It is not a game out here in the streets. That Delta variant is very, very deadly. So thank you all again. Thank you, Dr. Lenore. And we'll see you all very soon.